Hi, it's Dr. Jess Daigle of Mom and Me, MD, and I am going to start bringing regular content weekly about topics to help moms and their little babies. And it can be for both preterm and term babies and moms, whether you're a new mom or a veteran mom. Okay. And this is designed to bring you peace of mind. Okay. So it's lots of different things to learn about being a mom and taking care of your baby. And a lot of it is seasonal, you know. And so I am a wealth of information. And my favorite thing is educating and reassuring families. And so that is what I'm going to do using this platform. Okay. And so for my first kickoff video in this format, I want to talk to you about the common cold and managing that in your baby. Okay. So the common cold consists of a lot of different viruses, which when we tested at the hospital may have at least 16 viruses on there, like RSV, which is respiratory syncytial virus, or parainfluenza, or rhinovirus, or enterovirus, or rhinovirus. The list goes on. And these are different viruses happen in certain seasons. So there are some that's more in the fall and the winter and the spring. And we've labeled them the common cold because, they fairly have similar symptoms, which can be some congestion, low grade temp like fever, 99.5, 100.4, 101, 102, depending. And some runny nose, a little bit of cough. Sometimes their ears may hurt. Sometimes it can even filter into some respiratory distress because they can get a little bit of lung infection, like a viral pneumonia as well, or because you can have viral or bacterial pneumonia. And so these viruses cause these symptoms, which causes your baby and your child to not feel well. And I mean, as I'm sure you've probably had a cold at some point in your life, you know how you feel. You're tired, you don't want to eat, even though you know you need to. So you're trying to get fluids in yourself through other means like soup or tea and all these different things. Okay. And so for a little baby, it becomes a challenge because one, they're nose breathers. So anything that blocks the nose, causing them congested, it's going to give them distress and trouble because this is the main thing they use to breathe. Okay. And so when they can't really breathe well, then they don't really want to eat that much either because it's kind of plugging up everything. Right. And then they just overall don't feel well because this virus is overwhelming their system. Their immune system is pulling all its resources, calling all its soldiers to fight this infection. Okay. And so, how can you help your baby during this time or during this type of illness? You need to have a humidifier. Okay. Our nasal passages have to remain a little moist. It's what helps to move like the pathogens, the virus along, allow stuff to drain. You want the stuff to drain. As much as runny nose gets on my nerves, I know, because I feel like when my daughter is sick and she's just a drainer, it's good because you want it out. You don't want it in. And so the humidifier helps to keep those passages open so stuff can drain, right? Saline helps with that too. So if you have some dried stuff, you put the saline in your nose, you use the bulb suction. Remember, you push in to create that vacuum. So when you put it there, that air will suck along with the mucus into that bulb and you're going to push out and release it. Now, when I tell people to do the suction, I tell them put 1 or 2 drops, rub the nose, another 2 drops, rub the nose, wait about a beat of 5 seconds, then go and see what you can get because you want that saline to kind of loosen things up in the nose. All right. And then you want to be able to get anything. And then at the end, when I think, okay, I think I've gotten what was there, what I can see at least or appreciate, then I put 1 to 2 drops again, massage, but I leave that because you want to keep the nose moist again so stuff can continue to drain. And then you might find they actually make some tickle their nose so they sneeze and stuff comes and you're like, yes, that's what I want. I want you to sneeze that mess out. Okay. So humidifier, cool mist humidifier, because a lot of times we run the fan. Like we like to run the fan, and we like the air. It dries them out. It's drying it out. And then they're, that's how they sound. And then they can't breathe. They can't eat like that. So if your baby's having these problems, it's good to check the nose, the suction before the feeding. Help open it up. And yes, a little bit of saline may drip into the back of their throat. They go, and they're going to hack and cough a little bit. It's okay. They're going to clear it. Then they can eat. You'll find like 99% of the time, you find they hate it while you're doing it. So I will warn you, it's not pretty suctioning your kid's nose. Like nobody wants to do it. I have to hold my toddler down or, she's a baby, I will swaddle so her little arms can get right there. And then you do what you got to do. You got to remind yourself that sometimes it's the hard things you have to do to help them get better. Just like parenting in general. Like, you don't let your kids eat all this candy because it's going to make their teeth fall out, right? You don't feel bad because you can't, let them eat candy all day. You're trying to be a good parent, okay? So sometimes it's uncomfortable doing these things. But humidifier, some saline, having the nasal aspirator. Not all nasal aspirators are created equal. Now, we used to have these really good bulb suctions, like these orange ones at the hospital. I feel like they would suck your intestines out through your nose. It was that strong. We don't want that, obviously. I just mean that it was really good. It was a good suction. Now these little blue ones, I don't know what those things are doing. But they have some over-the-counter, like, motorized ones and things like that. And just like with your humidifier, with anything that you use, cleanliness, hygiene cannot be underestimated. So paying attention to if the parts are turning like moldy or anything like that, you have to either learn how to clean it properly or toss it and get another one after a while, okay? But it's important to dry these things out, clean them routinely, whether it's every day, every few days. Even the bulb suction, I used to suck peroxide and stuff up in there and squeeze it out because you really shouldn't be spraying nothing into a baby's nose anyway. So it's always meant to be sucking stuff out, okay? But even that I would clean with some peroxide stuff, some just stuff to kill any bacteria and things that might be trying to go up in there. So saline, bulb suction, humidifier, and then these things will help you in just trying to do what you can to get fluids into your child safely, right? We don't want to force feed them, drink, trying to pour stuff. They're not really actively wanting to eat. This is an indication for going to the hospital and possible admission for IV fluids and things like that. So, a lot of these things have a phase, right? Like 5 to 7 days, usually a cold, they should be coming down. Cough is the last thing to get better a lot of times. But this is how you manage nasal congestion and this respiratory viruses. Hand hygiene is key as well. So I hope this video has been helpful. Definitely leave comments. Put in the comments anything else you want me to talk about, whatever you want to learn about. And I'd be happy to do a video on it. Okay, until next time, I hope you have a great day.